My name is Elizabeth Kopplin. I'm 41 years old and I'm going in for my second hip replacement. From an orthopedic standpoint, I had a tremendous amount of difficulty walking. Limited range of motion, stairs were very difficult. Keeping up with my son was incredibly challenging, so just quality of life issues, daily activities were challenging.
When Liz first came to us, she had a lot of trouble just doing normal activities, basic hygiene, showering, getting in and out of a car, tying her shoes and socks. She couldn't do those things. So one of the telltale signs is when someone comes into our office, and we know how bad it is when they constantly just wear slip-on shoes. She was pretty severely disabled as far as that goes, but had a lot of pride and didn't really want to admit to how dysfunctional her life was at that point related to her arthritis in her hips.
I had several trials with orthopedic physicians. What led me to Dr. Levine was from the minute I walked into his office, I knew I was in the right place. The pain had become unbearable. It was a point where I couldn't walk most days, so for me it was time to just make the decision that we needed to get serious about correcting this.
For her, we did a relatively small incision procedure for her, and you basically remove the arthritis. So the hip is made out of a ball and socket. You basically remove the ball, and then you clean the socket and you prepare it for a metal cup and a metal stem that goes into the femur or your thigh bone. And those are made out of titanium, where the bone will actually grow into those pieces and stay with her for the rest of her life.
Well, surgery can be a frightening thing in general, so of course I had reservations about surgery, but I think what really helped me decide and go forward with it was the amount of information I was given up front about the surgery, the process itself, the recovery, the hospital staff, what their involvement would be, and then the actual surgery was much easier than it was in my mind. The recovery was great, the nurses and the staff were wonderful, and all of the information I had really helped to make that process just go a lot easier.
Life for Liz after her first replacement has been a drastic change. She's able to do things that she hasn't been able to do in a long time with her right leg. She's able to go up and down stairs much more easily. She's able to get in and out of cars, put her shoes and socks on, do the stuff that she really wished she used to be able to could do, dating back to probably almost her teenage years when this started for her.
The most positive thing about my experience at Elmhurst Memorial Hospital was the staff. They're just incredible. There wasn't one person who wasn't helpful. I mean, everybody made my experience here just so enjoyable, and it was just pleasant. And then that extended to my family who came to visit, my mother who was staying with me during the process. Everyone said the same thing. It was just an incredibly nice facility to have this done. Made it a lot easier. You have no idea what your life will be like until you've done this. It's like I say to my friends who ask me, why all of a sudden did you decide to do this? And it's not a sudden. When you live with something like this, you know the process and when you're ready to have it done. And when you're ready to have it done, find someone you're comfortable with and do it. I mean, it's a game changer. Life is just different. It's better.